The aim of this conference is to bring the audience an update of tendinopathies, soft tissue injuries, and our treatment proposals called MEP, Percutaneous Microelectrolysis. My name is Ronzio and I'm the director of MEP. Percutaneous microelectrolysis is a technique that uses a low-intensity galvanic current with a high current density, which is applied with an acupuncture needle to promote the controlled local inflammation and free radicals inhibition. MEP complies two treatment options, one called beauty for wrinkles and stretch marks, and another one for sport injuries such as tendinopathies, muscular lesions, pain, and other pathologies. Everything started with Volta, who created the galvanic current. Faraday studied the electrolysis process. In the 40s, researchers used galvanic current for electrocoagulation. In the 80s, some authors used electrolysis for tumor treatment and hair removal. In the 90s, Giro and Giro studied the collagen regeneration in stretch marks and wrinkles with the application of a low-intensity percutaneous galvanic current. In the year 1999, the EPI appears, which uses a galvanic current with doses used for tumor to treat tendinopathies. Finally, in the year 2006, we started to research low-intensity galvanic current in soft tissue injuries based on Giro's doses. At present, it is used in many sports centers, soccer clubs, hockey, soccer, and rugby national teams, among others. The electrolysis has been described in all books, for example, in this one of 1921, where you can see the chemical equation in tissues. At the end of the 90s, Robertson described a correlation doses necrosis and the differences between anode and cathode. Most of tendinopathies are chronic lesions. Histopathology describes lack of inflammation as the cause of absence of collagen regeneration. You can see that in this comparison between a normal tendon and an injured one. We have different physiological effects. The electrical stimulation causes acute inflammation, pH normalization, and analgesia. We have the mechanical stimulation and the sympathetic stimulation. That explains the aim of this treatment. When we have a tendinopathy and we induce an inflammation, we are going to promote a regeneration. Indications: tendinopathies, plantar fasciitis, scar and neuropathic pain, myofascial trigger point, delay onset muscle soreness, fibrosis, acute, subacute, and chronic inflammation, soft tissue lesions, pyramidal syndrome, and more. Here we can see some photos taken at the beginning of MEP experience, applied in rotator fibrosis and trigger points. Let's talk about some publications and cases. As mentioned before, percutaneous galvanic current started to be used in aesthetic fields. You can see in this slide the results in stretch marks after 5 sessions. This technique can be applied with ultrasound-guided, which turns into a more specific treatment. In spite of this, most of the publication papers don't use ultrasound, and this resource is not available for most physical therapists. You can see here MEP application in the biceps tendinopathies. This professional soccer player suffered a trauma in his patellar tendon, causing a tendinosis. After 1 year without playing, he started with MEP treatment. The video shows the algometry before and after 1 session. The first measurement was 1.5 kilograms per square centimeter. After the treatment, the algometry is going to increase. You can see here the increasement up to 4.4 kilos per square centimeter. In this clinical trial, 2 myofascial trigger points were found by digital palpation, one per upper trapezius. Algometry was used to measure pain. The patients were divided in 2 groups, control and treatment. The results show a major increase in algometry in the treatment group. In this first clinical trial in Achilles tendon, the patients were divided in 2 groups. One received conventional treatment and the other one conventional treatment plus MEP. The evaluation was made by VISA questionnaire. For example, in this question included in the VISA, the group treated with conventional treatment plus MEP showed a greater improvement. You can find in our website or in the scientific databases the full text paper. You can also observe the range of motion increase after one treatment. We have many research allies, such as Universidad Maimónides, Universidad Favaloro, Universidad Portiguar, Instituto Universitario Barceló y Universidad Cuauhtémoc. It is possible to get the practitioner certification in several countries like Costa Rica, Brazil, Argentina, Uruguay, Peru, Spain, Chile, Mexico, Ecuador, Colombia, and more. Thank you very much for your attention. I hope you have enjoyed the conference. Visit us at www.microelectrolysis.com.